CYC is a free channel, presents the Word of God for everyone. Your support will help us to continue the mission. Visit our website, cycnow.com. Even $1 will make a difference.
Hello, and welcome again to another episode from our new series, CYC MD. In this series, we are exploring different specialties and speaking to them as almost a day in their profession. Today, we will be focusing and exploring the roles and responsibilities of an oncologist. As we know, cancer can be a long, imposing, and difficult battle that both a patient and loved ones go through together. Many people can even share personal stories of loved ones that have suffered or are currently suffering with cancer. The role of an oncologist is to ease the struggle of a patient, both medically and emotionally. Without wasting any time, let's speak to the oncologist himself. I'd like to welcome Dr. Hania Ashamullah. Welcome, doctor.
Thank you, Mary. Good
Pleasure
be
to
here.
have you.
Thank you.
I want to start off by asking you about the education process.
Okay, so I wasn't trained initially in this country, but normally after finishing medical school, you go through 1 to 2 years of medicine or some other specialty, followed by 3 to 4 years of oncology, then a fellowship in whatever subspecialty you may have to go through. And after this, you become an attending or a specialist. I'm not sure how it is in Egypt nowadays, but in the States, it's about 7 to 8 years total.
We all know the road to being a doctor is quite long.
Right.
Is being an oncologist any different from just being a regular family doctor in terms of years of studying?
Yes, in many aspects. A regular doctor could become a regular doctor in 3 to 4 years. An oncologist, whether he's a surgeon, a medical, or radiation oncologist, would need about 4 years plus 1 year of medicine, then 1 or 2 years of fellowship. So it's at least 3 to 4 years more.
Wow. So where do you work, and what is your position and what's your title?
So by training, I'm a radiation oncologist, and my title or my rank is I'm the chairman of radiation oncology department in New York Methodist Hospital, and I'm a professor of oncology in Cornell University.
Many people, when people, even high schoolers, when they're trying to look into going into a profession, many people actually stay away from the medical profession.
Yes.
For maybe saying that it causes an imbalance to their lifestyle.
Right.
I want to ask you about your lifestyle. How is it being an oncologist, and how do you maintain a balanced life with your wife, with your kids, church, with yourself?
So it really depends a lot on you. You have to balance ambition to what extent, and not to reach a level of greediness. If you can balance, and you're supposed to, you should have a good, normal family life while you are a successful doctor. On the same token, I wouldn't trade my job to any other job regardless of the money, because not just an oncologist, but especially an oncologist, you really feel like you are helping a lot of people. So yes, there is a lot of years of studying, a lot of hours of studying, a lot of times on calls, but eventually you feel like you're really benefiting a major sect of people. And if you put the cancer patients as you're introduced the topic, that's like valuable.
So basically you're saying any profession you go into, just go into it with the passion.
Correct.
And without any other. So just so that all our viewers are on the same page, what is an oncologist and what is the role of an oncologist?
So the oncology is the science of tumors. Came from the word onco. Log is science. So oncology is a science of studying tumors. An oncologist is a specialist that's specialized in usually malignant tumors, but it could be any tumors. So the type of oncologist varies. So there is a surgical oncologist, there is a radiation oncologist, and there is a chemotherapy doctor, which is called medical oncologist. But at the end of the day, all of us deal with patients who may be suffering from one type of cancer, regardless of what stage of the cancer is.
And you mentioned earlier you fall under a radiologist, oncologist.
Right, it's called radiation oncologist, which, as I said, there's one of the three main items of treating cancer, whether it's surgery, radiation, or chemotherapy.
You know, one of the big questions that, you know, many of our viewers even may just be even wondering with this topic is, what is cancer? You know, sometimes when it's such a fearful word that people don't even like saying it, or when they say it, they whisper it.
Basically, cells are driven by their DNA, their genetic background. Now, should the DNA gets a wrong signal, rather than it's supposed to stop growing or grow in a certain pace or destroy itself, now it's growing without pace, in any time, in any place, and sometimes does not get destroyed by itself. And that's what makes a cancer grow, that the cancer cells are not checked anymore. They are unchecked cells. And the cells could multiply, could become a bigger number or a higher number in a very short time, which we call it sometimes the doubling time, meaning the number of days or sometimes hours it took a cell to become double. And in cancer, this could be much shorter doubling time, meaning it takes much less time to become double. And that's what was supposed not to happen in a normal cell. So that's, in a nutshell, what is cancer. Of course, a cancer cell could have different picture or different morphology. It may have a large nucleus, it may have more than one nucleus, it may be a large cell, it may look a little different than the initial cell that came from. But at the end of the day, the background is they are unchecked pattern of growth.
So what are triggers or risk factors that can cause cancer?
Yeah, so a lot of times we don't know. But generally speaking, it's related to a genetic background that sends a wrong signal. So this genetic background could be because of an inherited disease. So a mom or a dad sent a wrong genetic material to their daughter and she developed certain type of cancer. And that's what we call heritage or inherited types of cancers. Not all cancers are hereditary. Now, there are cancers related to outside factors, ultraviolet rays, like you get skin cancer or melanoma, maybe cigarettes for lung cancer, bladder cancer, throat cancer, lip cancer, mouth cancer. All of this come from smoking, for example. Alcohol, for example, is another predisposing factor to liver cancer and somewhat gastrointestinal cancer. There is also occasionally viral infections, and this is found recently, maybe in the last 10 years or so, that there are certain viruses can result in cancers. One of the most common that we hear often now is cervix cancer in women. And that's why in girls who are sexually active very early on, they ask them to take the vaccine, which became available about 5 years ago. There is also something called HPV virus, human papilloma virus, which causes tongue cancer and mouth cancer. So they are related to viruses. So these are the general rules why the cancer occur, but there are times that we may not find the virus, the patient never smoked, the patient does not have a hereditary factor, but still develop cancer. That's when we don't know where the cancer came from.
You mentioned earlier that the study of oncology also has to do with tumors. So what is the difference between a tumor and cancer? I know sometimes they say something that a tumor is benign and malignant, but what is all that?
So a tumor and a cancer both share one concept, that both are growth. However, the word tumor could really encompass both, a malignant and a benign. So we can say a malignant tumor and a benign tumor. But once we add the word neoplastic, becomes cancer, or we add benign, which becomes a benign tumor. So a person who gets a lymphoma on the hand or in the trunk, or basically it's a fatty tissue, it's a fatty tumor, does not have to do anything with anything, it's not going to go anywhere, it doesn't even have to be treated. Sometimes there is a brain tumor that's benign, like something called meningioma. Some of these tumors, if grew, then they need surgery, but generally speaking, we can just watch them, observe them, and a lot of times they do nothing. While the cancer is a completely different ballgame because, as I explained, they have the ability to multiply and to have doubling in a very short time. So it starts to grow in a very short time, while the benign tumor can grow very little over many, many years. The cancer has the ability to spread to somewhere else, while the benign tumor never spreads. So those are the general rules, how to distinguish a benign tumor versus a malignant tumor.
We will be taking a short break and we will be right back. Welcome back to CYC MD. We are here with Dr. Hani Ashamallah. So we were talking about cancer spreading. Yes. So we sometimes hear when patients even talk to us or other people talking about cancer, that cancer has spread to the brain, the liver, the lung. How does cancer spread?
So as I explained before the break, the cancer spreads because of the unchecked growth of cells. However, it goes to another organ via many types of spreads. One is invasion or infiltration of the tissue that the cell arises from. For example, a tumor in the lung could start to get bigger to invade the lung nearby, or even go to the muscles of the chest wall. A breast cancer could invade through the skin and cause bleeding. So this is what we call a local spread. However, the more and the more aggressive types, that the spread goes to another organ via bloodstream. So the cells get into vessels, usually veins, and they travel along the venous system to deposit themselves in a different organ. Could it be the brain, as you said? The most common usual place of spread is the lung, liver, and sometimes the bones. The third type of spread is through the lymphatic system. And just for the viewers who may not know what a lymph gland is, when we were young and we used to get sore throat, we used to get a little swelling here called the lymph node. And this lymph node, when it's bigger, that means the infection went from the tonsil or the throat to the lymph node. Now, these are what we call in cancer a lymph spread. So the cancer from the lung or from the breast to go to the lymph nodes under the arm. A lung cancer go to the lymph nodes in the middle here, which is called mediastinum. It can go to other lymph nodes. So a cervical cancer from the uterus can go to the lymph nodes here and then can go travel to other lymph nodes. The last type of spread is a spread through a space. So for example, people get fluid around their lung. ovarian cancer, people may get fluid around in the peritoneal cavity. So that's what we call spread within a coelom or within a cavity. Of course, each type of cancer has its own common modes of spread. Like, it's very common for breast cancer to go to lymph glands. Number one, go to lymph glands. It's very common to lung cancer to spread through the blood. It's very common, for example, a tumor in soft tissue in the leg to spread through the tissues of the leg, not spreading anywhere. So it depends on the type of cancer. Like breast cancer commonly goes to lymph glands and bones, while lung cancer can go to lung, go to liver, can go to brain, and so on.
Well, as far as cancer is concerned, we know that there are different stages for cancer. Does that have to do with the spread, or is that its own?
Generally speaking, yes. So a very early cancer is usually a stage 1. Mm-hmm. A very well spread cancer is usually called stage 4. Almost all cancers, we apply the same rule. Almost all. Very occasional exceptions. And 2 and 3 are in between. And it needs a lot of time to explain each stage of each cancer. But generally speaking, say 1 or 2 centimeter tumor in the lung or in the breast, you did not go to lymph nodes, did not travel anywhere, it's called stage 1. Once it goes to lymph nodes, it could be stage 2 or 3. If it goes to the bloodstream, to the liver or to the brain, it's called stage 4.
And we can obviously say those in the earlier stages are probably more curable and treatable than
Very
those
much
in the
so.
later stages.
Very much so, except in children tumor, a lot of stage 4 tumors are still curable, while almost always stage 4 in non-children does not mean it's deadly, but it's usually incurable. And in the new science, we are able to sort of suppress the cancer in late stages, as you mentioned, may not cure it, but almost make it as a chronic disease, like diabetes or asthma. People never get free of diabetes, but they have their diabetes controlled. The cancer, say of the ovary, if the stage 3 or 4, may not be cured, but can be suppressed and controlled for many, many years. And that's the beauty of the new developments in cancer treatment.
Mm-hmm. Well, since we're on the topic of cancer and cure, when a patient is diagnosed with cancer, many times their first question to their doctor, oncologist, whoever has diagnosed them would be, is it curable or is it treatable? Mm-hmm. So would you say cancer is curable, and what are some treatments? Okay,
so in today's management in the 21st century, there is a lot of cancers are cured. Almost all cancers are treatable, generally speaking. The word cure, we don't take it lightly. We only speak of cure after 2 or 3 years, sometimes after 5 years. Like in prostate cancer in men, we don't speak that the patient is cured except beyond 5 years. While throat cancer, larynx cancer, voice box cancer, if the patient does not show any signs of cancer after 2 years, usually the patient is cured. There are cancers, however, that we treat but we do not cure, but the patient continue without too much symptoms from the disease. So, and I think you were smart enough to allude to that the earlier the cancer, the cure rate is higher, the later the cancer can be treated, can be controlled, but the word cure, we do not just take it any lightly.
So what are some preventative measures that you can inform our viewers to take to be able to detect cancer at an early stage if possible?
So cancer is a very deceiving disease, and that's why it's called cancer. However, there are certain things can be done to detect it early, and there are some tests that can be done to diagnose it in earlier stages. One of them, women who are, say, in the age of 40 and around 35, 40 and above, to do breast exam on themselves. And usually we ask them to do it in the middle of their monthly periods, between the two periods, so their breasts are not quite tender. And usually if they examine themselves very well, if they find something and they are trained, they can go to the doctor early. For example, there are certain tests now can be done to detect cancer early. For example, especially people who come from Egypt, where hepatitis C is an epidemic, and hepatitis C could result in liver cancer. We would like to know if the patient has infection or not, if the virus is active or not, and take the vaccine against hepatitis B, for example, and that lower the risk of probable complications. There are x-rays, like mammograms, where they take an x-ray of the breast, usually once a year over the age of 40, to make sure there is no abnormal nodules, and if so, we take a biopsy if it is looking malignant. Sexually active girls, we like them to take vaccine. Normally when we talk to young girls who unfortunately lost their purity or virginity at a younger age, we start talking to them about a vaccine against a viral infection that could result in cervical cancer. So there are many things can be done. A patient can do it to himself. The doctor can order tests, whether blood or x-rays. Unfortunately, in spite of all what I'm saying, the best way to prevent cancer is to avoid the predisposing factors that we spoke of about. Smoking, for example, 100% proven cause lung cancer, tongue cancer, throat cancer, many others. Drinking heavily, overexposure to the sun, not just occasional going to the beach. All of this are reasons for us to almost try to reduce the possibilities of cancer by removing the predisposing factors.
Thank you so much, Dr. Haney. Unfortunately, we are out of time. I know there are many more questions that you have still on your mind. What are more treatment methods? What if a patient is diagnosed with cancer? How can they live a normal life? What are complications that are associated with chemotherapy treatment? All these questions and many more will be discussed in our next episode with Dr. Haney. Please stay tuned. You don't want to miss it. Until next time, God bless.